Hi, everyone, and welcome back to the Mom Boss stage. I hope you guys enjoy Alyssa's keynote that we just saw. I'd like to introduce our next speaker. This is Hannah Ross from Vital Physiotherapy, and she is going to do a great talk for you guys. So enjoy, Hannah. All right, enjoy, Hannah.
Hi, everybody. I'm Chana Ross from Vital Physiotherapy and Wellness, and I'm so excited to be here. I was here last year as well. We're going to talk today about pelvic health and postpartum abs. So again, like everybody else, this is the first time I'm sort of chatting and speaking on this kind of platform. So if you're in the chat, say hi. I invite you to be interactive and ask questions. We are going to be talking about our postpartum bodies. And let me know if you have any thoughts, any questions, or any concerns along the way. Again, my name is Chana, and I'm actually the clinic director of Vital Physiotherapy and Wellness in Toronto. We are a women's health and pelvic health clinic. And I sort of stumbled upon this accidentally because I am a mom of 4. And that wasn't accidental. The pelvic health piece was accidental, just so we're all clear. In between babies 2 and 3, I was having a lot of pain. And I went to my doctor and I said, I'm having all this pelvic pain. Something must be wrong. There's something wrong with me. And she sent me for testing, and an ultrasound. She assessed me and she was like, nope, you're good. Nothing wrong with you. And I knew that there was something wrong. I was still experiencing pain. Nobody had told me prior to having babies that after having babies, your body felt that way, that pain would be expected. And I really felt broken. At the same time, a friend of mine was getting trained to do pelvic health physiotherapy. So she, for those of you who don't know what pelvic health physiotherapy is, pelvic health physios are just regular old physios. They've done all their regular training, and then they take extra training to be able to assess internally. So we can do vaginal and rectal assessments. And when she said to me, come, I'll treat you, like it's gonna be terrific. I'm gonna fix you. I was like, you are not putting your fingers anywhere near me. There is just no way that we're gonna do that. But it took a little bit of coercion, and I was like, you know what? If you can get rid of this pain, I'm actually willing to do anything. And so I went to see her, and within a couple of treatments, my pain was gone. So it was an absolute light bulb moment for me. Number one, that our body postpartum, our symptoms postpartum tend to be poo-pooed or minimized by the classic medical community, but also that there are real, tangible, and amazing treatments and people out there who could actually support new moms in rehabbing their bodies. And so at that time, I had been a physio for about 5 years at the time, and I kind of gotten disheartened. I was like, I don't want to treat elbows, I don't want to treat shoulders, I don't want to treat knees. And having been through this rehab, I was like, I can talk about vaginas. So here I am today talking to you about vaginas. And what I'd like to do is take you guys through my top 3 tips for rehabbing your abs postpartum. And so rehabbing your abs and rehabbing your core. Okay, so join me. Let's get to it. So tip number 1 is to actually train from the inside out. A lot of people are like, why is my personal trainer not talking to me about my abs postpartum? And they do, and great personal trainers. And there are a couple here. Jess Bennett's here. There's a whole bunch of really great personal trainers who are truly trained in postpartum rehab. They are an amazing resource when we're rehabbing our core. But when we think about our core, at the end of the day, we're gonna end up talking about pelvic floor. So for your entertainment, I brought my pelvis with me. This is my friend, the pelvis. We're gonna talk about what the pelvic floor is and why it's so essential as part of your core rehab postpartum, okay? So this is the pelvis. If you take your hand and you place it on your hip, you're actually placing your hand on the top of your pelvic model. If you take your hands and you place it at the front of your pelvis, and you sort of touch the area where your mons pubis, where the hair is above your vagina, that would be this area here. And if you take your fingers and you place the top of your finger at the very top of your bum crack, you're actually placing your finger along your coccyx bone right there. So your pelvic floor muscles are actually 3 layers of muscles that sit underneath the pelvis, okay? They attach all the way from the front to your pubic symphysis, all the way to the back to that tailbone that we just felt, and side to side from one sits bone to another. And these 3 layers of muscles have 5 really important jobs. Job number 1 is to ensure that you are continent. So when we're thinking about postpartum, one of the funniest things that we hear is, oh, ha, 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 so cute that I love my baby. It's so nice that she's so cute because otherwise, you know, I would be really unhappy because now I can't laugh without peeing. Or what did you expect? Of course, you had a baby. Of course, you should be leaking. It's actually the job of these 3 layers of muscles to ensure that you don't leak. It's actually never normal to leak urine at any point in time. If you're leaking urine, you should seek help because if we bring it back to our core, the pelvic floor is actually part of our core, and that's a sign that your core needs support, okay? Job number 1. Job number 2 is sexual function. Postpartum, one of the most common symptoms, regardless of whether you've had a vaginal or cesarean birth, is to have pain with sexual activity postpartum, or even during pregnancy. It's the job of these muscles to ensure that you have a healthy sexual life. If these muscles are overworking, you're going to tend to have pain. You're going to tend to have lack of sensation or inability to orgasm. If they're too weak, you're also going to have inability to orgasm and lack of sensation. So both ways, you need some help. Okay. Those are the first 2 jobs of pelvic floor. Job number 3 is to help pump the blood back to your heart. Job number 4 is to hold up your internal organs, to hold up your uterus, to hold up your bladder, to hold up your anus. Those, and so your rectum and all of your internal abdominal organs, your intestines, your gallbladder, your spleen, all those organs need to be held up by your pelvic floor. The 5th job of the pelvic floor, which is why you guys are all here, is actually to function as part of your inner core. So when we talk about core, right away we start to think about our abs, our obliques, our 6-packs, right? Because we all obviously had 6-packs before, and we're obviously going to have 6-packs after. But this is not the actual core is made up of your pelvic floor, your innermost layer of abdominals, your innermost back muscle, and your breathing muscle. So the way that these muscles support you is by creating stability around your spine, and they work by ensuring that your pressure inside your abdomen is able to stabilize you and support you. A lot of the time postpartum, we're feeling like almost like those outside of car dealerships where they have like those blowy things and you're up in the wind and you're blowing side to side. That's what we end up feeling like postpartum, like we've got no stability around our core. And that's because these 4 inner core muscles end up, thank you for laughing, they end up getting stretched, they end up getting overworked during pregnancy, and they usually work together as a system. And during pregnancy, that system gets disrupted and has to be retrained postpartum. And when we're seeing clients postpartum, we're either seeing clients who have looked up ab rehab online and they've read, never do anything, never do any planks, never do any ab work, never do anything. And we've scared the daylights out of women so that don't do, and they're just paralysis by analysis. They don't do anything. And on the other end of that is we often see clients they're working their core, they're doing their planks, they're doing their sit-ups, they're doing their crunches, and they're still not seeing results. And the reason is because tip number one for rehabbing your postpartum abs is you need to rehab from the inside out. We have to retrain this inner core system before anything else. The way that the system works is that your breathing diaphragm, which sits underneath your ribs, I'm going to angle myself down here. It sits underneath your ribs here. It's upside down, U-shaped. When you take a breath in, it actually descends down into your abdominals, into your abdominal cavity, and allows your lungs to expand. So when you breathe in, your diaphragm pushes down, okay, our breathing muscle. It pushes all of your abdominal contents and your pelvic contents, all the good stuff that's hanging out here actually gets pushed down and into your pelvis. And your pelvic floor muscles that sit right at the bottom, they actually receive all your organs. So you inhale, your diaphragm pushes down, your pelvic floor should relax, and as you exhale, it springs back up. And there's this beautiful synchronicity that happens in a system that's working well. On every breath, on the inhale, your pelvic floor should relax, your abs should relax, and your diaphragm contracts. And on the exhale, your diaphragm relaxes, your pelvic floor should contract, and your inner abs should contract. And those muscles work together to stabilize you. What happens during pregnancy is that your diaphragm sort of gets shoved up into your neck. Like when I was, I don't know, like I'm little. You can't see because this is a virtual conference, but you know, there's really very little room for my babies inside my belly. So my diaphragm got shoved pretty far up pretty quickly, okay? Going up a set of stairs was no fun. But so diaphragm gets pushed out of position. Your pelvic floor, which is used to holding your uterus, right? Now starts to carry, let's say 30, 40, 50 extra pounds of weight. So it is doing all the work of holding up not only your baby and your growing uterus, but also all of your organs at the same time. And your ab muscles naturally stretch out as they're supposed to be, okay? But that there's 4 layers of abdominals. There's your six-pack muscles, there's your oblique muscles, and there's your innermost abdominal muscle. And all of those muscles get stretched out. We need to retrain all of the abdominals, but we have to start from the inside out. You have to retrain your innermost abdominals, your pelvic floor, and your diaphragm, learning how to breathe before you start anything else. Okay? With me so far? Beautiful. So the second most important way to rehab your abs postpartum, the most important thing to think about is your posture. So we see clients who they come in, they get their homework, and they are amazing at doing their homework because you don't get better unless you do your homework. That's the rule, you guys, okay? They do all of their homework, and it takes them, let's say, on a good day, 15 minutes to get their homework done, okay? But the rest of the time, they're standing in terrible posture. Now, as a rule, I will not tell you that there's a good posture versus bad posture. However, when we're retraining your core, there are postures that make it easier and there are postures that make it harder. So when we're trying to rehab that system, we really want the diaphragm and the pelvic floor, those inner core muscles, to really align so they're moving well together, okay? So what that means is we're not going to stand in mom posture. And I'm gonna move out my chair and I'm gonna demonstrate for you guys, okay? You're welcome. So, during pregnancy, yeah, I'm moving my furniture here. During pregnancy, as your belly gets bigger, what we end up doing so that we can counteract falling on our faces, which is in nobody's best interest, we end up starting, as our bellies grow, we actually start to tuck our bums under so that we can bring some of our weight back and allow our bellies to come out further. So instead of standing like this in neutral posture, what I would consider, and falling forward, we start to bring our weight back onto our feet, and we start to bring our rib cages backwards to sort of hang out and hold and prevent ourselves from falling. Then when you have baby, you do the same thing. My pelvis is gonna be my baby here. You ready? Newborn, you keep that tucked under posture, keep that leaning back position, and now you have the weight of your baby. I do really love my pelvis, so it is fitting that I'm holding it as my baby. And we start to weight this posture. What this means is that our diaphragm muscle is now further back from our pelvic floor, okay? Where our ribs are back relative to our pelvis, and my pelvis is tucked under, so it's out of position. So our pelvis is here and our diaphragm is here. What that means from a practical perspective is that even as you're retraining your system for a couple of minutes every day doing your homework, if you're spending the rest of the time in positions that don't allow that system to help, it doesn't matter. You're not going to see the changes that you want in your abs postpartum. So I encourage everybody to stand up straight. What that means is actually taking your weight and shifting it to the front or to the middle of your feet. So instead of standing in that tucked position, here we go, moving my chair back again. Instead of standing back here, we actually bring our weight forward onto the middle of our feet so that our ribs are stacked over our pelvis. What that does is it actually allows you to take in a full breath and allows those two muscles to start to work together in addition to the other 4 core muscles. Hope that makes sense. So tip number 1 is start to strengthen from the inside out. Tip number 2 is become aware of the positions that you're in all the time. Tip number 3 is to stop the negative self-talk. This is actually the hardest piece for everybody. There's a lot of talk around how to get your body back, top tips for bouncing back. Everything that you're going to see speaks to the fact that you are failing as a mother. Your body is failing you. That there's a proper way to do it, and whatever way that is, you're not doing it. You are not broken. Our bodies are made to rehabilitate. They're made to ensure that we as a species keep on keeping on, okay? It does mean that you need to take time to slow down, to allow your body to rehab, to allow your body to heal. Get some support in the form of a trainer who knows what they're talking about, from a pelvic health physio. Whoever you're seeing should be able to help you and help your body do what it would do naturally. But you are not broken, and you are absolutely in the right place, wherever you're at in your postpartum journey. So Chrissy's asking, is it something we can practice during pregnancy as well? 100%. So one of the things that we do during pregnancy is we ensure that you can still connect with your core. And I really want to be clear. We're talking about things like diastasis recti, which is really like, it's a catch, people use as a catchphrase for postpartum ab rehab. Diastasis recti just speaks to the fact that your 6-pack muscles are sort of stretched in between the 3-pack and the 3-pack. The tissue between it does get stretched out naturally during pregnancy. It's actually supposed to do that. That's what your body was meant to do. What you're not meant to do is be able to stick your fingers down in between your abs. If you can do that, then you just need to rehab postpartum, just like everybody else, okay? I digress. So during pregnancy, we make sure that you can still connect with your abdominals. We make sure you can both relax and contract your pelvic floor. And we really start to help you find that easy breath. So one thing that we'll do as soon as I answer Mariel's question as well, is we're gonna together find your easy breath. And your breathing is easiest when your diaphragm is stacked over your pelvis. As breathing, as your pregnancy progresses, obviously breathing gets a little bit harder because there's physically less space, but we make sure that you're connecting to your breath, both for delivery, because using your core is really important for delivery, learning how to relax your pelvic floor is really important for delivery, and learning how to breathe properly is really important for delivery. So, okay, so let's talk a little bit about finding the correct posture. Again, there's no good versus bad posture. It's really about finding a posture where we can find our easy breath. This is how we connect initially to that core system. So all of you watching, I can't see you, so I can't give you feedback, but I'm going to take you through the beginning stages of how to find that easy breath, okay? So sitting exactly where you are, just sitting regularly. I just want you to close your eyes, and you're just going to start to take a couple of slow, easy breaths, okay? We want to think about allowing our ribs to expand 360 degrees. What I don't want is for you to go to try to breathe in like that. You're actually just allow your breath to come into your ribs. So one of the ways that I like to do that is what I've coined awkward, angry hands. Take your hands, you place them where you'd place them if you're angry, and you just slide them up around your ribs. And you're going to take a slow breath, and you're just going to visualize breathing into your awkward, angry hands here, okay? Gentle breath in, into the nose. You're going to gently exhale through the mouth. Again, slow, gentle breath in. Just allowing your ribs to expand laterally. Your chest, it will come up and down, but we don't want you primarily breathing up here. And I don't want you pushing your belly out either. We're going to allow our bellies to move, but we're really going to focus on just allowing our chest to expand. I want you to make note of what this feels like. Is it easy? How much air are you getting in, and where do you feel it primarily? Okay. Then I want you to sort of hunch over and just sit in a crouched position. And I want you to try that same thing. Take your hands, awkward, angry hands, and I want you to just take a slow, gentle breath in. Allow your chest to expand. You're gently going to exhale. Just feel, where do you feel this breath? How easy is it? And how much air are you getting in relative to the position before? Okay? One more breath here, into the nose, out through the mouth. And now I want you to come and sit on your sits bones. So your sits bones are underneath your bum cheeks, okay? You guys can see my whole setup here. Underneath your bum cheeks, that bone right there, that's your sits bone. So I want you to pull away your bum tissue, and you're gonna sit on your sits bones, okay? You're gonna align your ribs over your pelvis. Use your awkward, angry hands again. And you're just going to take that slow, gentle breath in here as well. Gentle exhale. Inhaling here. Exhaling here. And what you should feel is you should feel a little bit of a curve in the small of your back. If you're practicing this in standing, we'd come from this tucked under position. You'd find the top of your bum cheeks, and you just lift up slightly. I call this lifting your tail up. Imagine you have just a slight tilt in your pelvis. And what you should feel is that you're actually getting in more air when you're sitting on your sits bones or when you're standing with that little tail lift. Because what we're doing is we're just making sure there's enough space between your ribs, your diaphragm, and your pelvic floor, and you're stacking them so they can actually work together. It's not complicated. It's pretty simple. It's just not easy to remember to do it throughout the day. And it doesn't mean that you'll have to be in this position all day, every day. But it does mean that if you're spending all day hanging out, in this tucked under position and leaning back, you're actually not stacking your ribs over your pelvis. You're creating pressure at the front of your belly, which is going to it's going to further allow that stretched out abdominal tissue to just hang out and be where it is, as opposed to allowing it to train and tighten. Because when you strengthen a muscle, you're actually contracting the muscle and making it tighter. Benita, I hope that makes sense, that those are better cues. Let me know if you want to think about some others my cues are can get really crazy. So I'm keeping the 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 stage ready ones for this talk here. But we can go further with that. Meredith is asking, I bounce on a ball while holding a baby. It's how he likes to nap, as long as he's napping. Check out Magic Juson's talk. Is it good or bad for my pelvis? There's really nothing that is good or bad inherently. Again, if it's causing pain, probably we can find something else to do. If you're noticing that afterwards you have back pain or your hips are hurting, maybe we can find something else to do. But actually bouncing on a ball is a good opportunity to try to just roll forward. Think about, and think about your posture as opposed to bouncing back like this. On a ball, it's a really great position to be able to start to do some dissociation of your pelvis. So learning how to go from that tucked back position to that rolled forward position. And feel, what does your breath feel like when you're hanging out, bouncing the baby? Can you breathe in? Can you exhale? Can you feel that? Can you feel that relaxing pelvic floor? Because on the inhale, you should actually feel your pelvic floor relaxing. You should feel it starting to touch that ball, the top of the ball. And as you exhale is when we start to get into that, the activating cue. Benita wants to know some of my crazy cues too. Later, Benita. There's some other things that would help with figuring out how to get that slow, easy breath is actually thinking about breathing into the back of your bra strap. So we can't actually physically make that happen. And so for those of us who want to make it happen, the awkward, angry hands here, a lot of us tend to try to make that happen. If you visualize breathing into the back of your bra strap, so sort of like, for those of you who are wearing bras, breathing into this upper area here, thinking about breathing there as we're inhaling does help to get that really nice lung expansion. Another trick that's also appropriate for our current circumstances is thinking about slowing down your breath. So instead of taking deep breaths, thinking about slowing it down. So counting. We're ideally thinking about making our way to about a 6 to 8 second inhale, which is challenging when you first start to breathe in. So breathing, taking a slow breath in, maybe that would be a 3 second breath in and an exhale. And then with every breath, trying to make it a little bit longer without going into that gasping for air spot, without going into that sort of position. How are you liking those, Benina? I can go deeper. Meredith, only thing I've felt recently is knee stiffness. So knee stiffness can mean a whole bunch of things. Probably because you're spending hours in one position bouncing. But certainly when your core isn't doing its role, what we end up seeing is each joint below it starts to take on more and more of the role of supporting and stabilizing. So if we start to see some hip pain, if our core isn't working, just because our hips are trying to do the job, and then the next joint down is our knees, and our knees postpartum end up doing a heck of a lot. Number one, because this is like an Olympic sport. Parenting is an Olympic sport, you guys. So you're on a ball bouncing all the time. That's probably a lot more bouncing than you've done in the past. And so it's reasonable to have some challenges or discomfort, like, as a muscle discomfort or knee discomfort because of that. But it's something to really consider is if that knee stiffness is sticking around and it's getting worse, I'd have that looked at, Meredith. Zoe saying, I'm pregnant with my third, had mild prolapse postpartum my last babe. What can I do now to better support my pelvic health and prep for labor? Oh my gosh, guys, so much. Zoe, that's such a good question. So a lot of the prenatal prep, a lot of the way that we're told to push during pregnancy, during delivery, is to hold our breath and bear down. What actually happens during pregnancy is actually our uterus is contracting, and trying to, but our baby literally has to exit through your vagina. Let's just call it what it is, you guys, okay? Okay, Asana's wrapping me up here. You can learn how to, I'm gonna make it really quick, Asana. You can learn how to relax your pelvic floor and push so that we're not pushing out all of our organs with our baby. If you guys are interested, I'm gonna put this into the chat. We do have a freebie, our top 3 tips to rehab your abs postpartum before returning to the gym. I'll put it into the chat right now. You can text 678-506-7543. Text the word vital, and we'll send you we'll send you those tips. Guys, reach out. I'm so happy to. You can either find me on Instagram, Vital Physiotherapy and Wellness, or text me, Ross.mp4 on Instagram. You guys have been amazing. Thank you for all your questions. Asana's like, get out of here. If I'm allowed to hang out any longer, I will. Thank you guys so much. Have the best time at MomFest. And thank you to Moms too.